Hello, good evening, and welcome to Know Your Fertility Wellness Hybrid Seminar organized by I Love Children. I'm Jill from Kiss 92, and I'm going to be your host this evening. Thank you so much for joining us, especially our live studio audience who have made it through the rain. Thank you for being here. Now, a couple of things to let you know before we get started. Today, we're going to be talking to a couple of doctors, but next week as well, join us because Know Your Fertility Wellness Hybrid Seminar is happening again next week on the 10th of March, and they will be featuring the experts from Thompson Fertility Center and Thompson Chinese Medicine as well. So if you have yet to sign up, including our in-house audience tonight, please do so. You can do it at www.ilovechildren.sg. For this evening, however, we're going to be having four doctors. Dr. Tan Si-Yen, she's going to be speaking about intimacy while trying to conceive, which I feel is a big, big problem. We all could use tips on how to improve this. Also, Dr. Lim Hui Hui, yeah, she will be speaking to us about all you need to know about cysts, fibroid, your cycle, and a PCOS. Now, Dr. Yi Tat Sin is going to be telling us more about all you need to know about sperm and male fertility. So grab your partner, make sure your men are listening and paying attention to that one. Dr. Liu Shu Ling is going to be speaking more about fertility after pregnancy loss as well. So stay tuned for that. Now, aside from our doctors this evening, just a couple of things to mention. We have feedback forms for all our studio audience and as well as our guests joining us on Zoom. There's a little box. You can have your questions. You can type in your questions for the doctors there as well. And remember to do your feedback form at the end of the seminar because you could be standing a chance to walk away with a gift packet from Clear Blue worth over $100 upon completion of your feedback form. Terms apply. And for those with us, as mentioned, remember to fill up your form and collect your gift pack registry at the counter after the seminar. And for next week, if you are a married couple on the journey of parenthood, you can visit once again www.ilovechildren.sg today and sign up for the fertility consultation or TCM fertility consultation that will be happening next Friday. Terms apply as well. Now, I Love Children's Know Your Fertility Wellness campaign is partnering with Thompson Medical Fertility Center to give a couple or couples fertility consultations worth $400 to help couples better understand their fertility wellness. But that's not all. I Love Children is also working with Thompson Chinese Medicine to give out TCM fertility consultations worth $200. Now, this is to help couples understand their body constitution and experience one acupuncture session as well. Terms apply. Now, if you need support, you need someone to talk to, you just need to exchange some ideas with people, you can join the Fertility Support Group. Now, these are peers that are trying to conceive. Join the I Love Children's Fertility Support Group and ask your questions anonymously to make yourself feel a bit more comfortable with that. You can share your personal experiences and hear from others as well. Now, before we begin, a little bit about I Love Children. I Love Children is a social service agency set up back in September 2005, so they've been with us for quite a while, with the purpose of keeping Singapore young by advocating a higher priority of having children, educating couples on fertility wellness, and promoting society where children are loved and mainstreamed. You can subscribe to ILC's newsletter and receive localized information through events, couple sharing, as well as articles. Or just simply follow them on Facebook, TikTok, and Instagram at I Love Children SG for event updates and parenthood tips. Now, if you wish to donate to I Love Children, do so at the website ilovechildren.sg and find out how you can donate and be eligible for 2.5 times tax rebate. So goodness all around there. This evening is once again brought to you by Know Your Fertility Wellness 2023, which is our event, organized by I Love Children, supported by Thompson Fertility Center, Thompson Chinese Medicine, KK Women's and Children's Hospital, Singapore General Hospital, APRW, Clear Blue, and Made for Families. So before we begin, we have had a little poll done by our in-house studio audience as well as on Zoom. So from our statistics, we can see that a majority, we've got 44% of us tonight are here, and they're all couples. So thank you so much for joining us. It is a team effort to get pregnant, and I'm very glad that we all have support here tonight. And also, how long do you think you need to try before getting pregnant? 44% of you think you need to try at least within a year to get pregnant. So I think that's a very good guess, but we'll find out from our doctors if that is accurate or not. Also, how long did it take you to get pregnant for those who have conceived? 74% of us in our studio audience tonight are still trying. And about, oh, okay, we're moving on. For those who are actively trying to conceive, how often are you trying? 57.7% say only during the ovulation period, which is what I did because a girl gets tired. Okay, a girl has to work and do other things. So that was my answer as well. Would you consider undergoing assisted conception procedures like IUI and IVF if you're having challenges? And 74.1% of our in-house audience have said yes, which I think is great. Ain't no shame in that, right? Now, how long will you try to conceive naturally before considering assisted conception? Let's see, 66.7% said after more than a year of trying, would you then consider assisted conception procedures? So, okay, we will see if that is a accurate representation, or maybe we should be trying longer. We're all here to learn, and we're all here to find out tonight. So which are the topics you're interested in? What is the most popular there? 92.6% says female fertility, followed by 88% male fertility. So you have come to the right place. Our doctors will be addressing all of that and more, your own personal questions, all this evening. So let me just talk about myself a little bit. I am Jill from KISS 92. I do the Sunday morning shows, 8 a.m. to noon. I have a 2-year-old daughter, and I started trying for my second one again this year. It took me about 8 to 10 months to get my first child, to conceive her. And I thought second time around, I know what I'm doing. I know my ovulation window. I know exactly what to do. Did not work out that way. It took me about 6 months to conceive. And after about 3 weeks, I suffered a miscarriage. And there's a lot happening in life, a lot of work things, a lot of family issues. And my child at the time was about 1.5 years old, and she was teething, so she was not sleeping through the night. And that was added pressure as well. All things that I feel contributed to, unfortunately, my miscarriage. And right after that, I tried again and successfully conceived. So I am 20 weeks on Monday. So yay, keep trying. You never know. But of course, it's up to the individual. When I experienced my miscarriage, it was very early on, and I decided, let's just keep going. Let's just keep trying. And it worked out. So we will see what we can do to strengthen the body after miscarriage, and how long after miscarriage should you then try, and what are some things we can do both physically and emotionally to help us try the second time round or third time round. And yes, so we will introduce the doctors now, and we will get to the seminar. That was a very brief introduction. I kept it short. First up, we've got Dr. Tan, who's going to be talking about intimacy while trying to conceive. Now, this is a big one for everybody. I know I struggled a lot with this, especially with already having a toddler, working, you're tired, you're coming out of the pandemic, now you're back in the office. How important is it to actually be intimate during this process of conception?
Okay, it's a very good question, Jill. So being intimate doesn't just mean being sexually intimate, right? People may think that, okay, I can just have sex to have the goal of having a baby, but over time you might find that just focusing on that one goal while you neglect other areas of intimacy, such as being physically intimate, emotionally affectionate, staying connected intellectually and in other ways, your sexual relationship will suffer as well. And of course, in the long run, that will affect the chances of conceiving.
I totally agree, because you get lost in life and work and the kid, and you're not really talking to your husband, and it's like, okay, ovulation, let's go. So
You're right, yeah.
he feels me, right? You understand. What are some of the main challenges you see couples are facing with this sexual intimacy?
Just like what you mentioned just now, I mean, all Singaporeans, we're so busy, right? So we know we want to have the goal of having a baby, so a lot of couples actually focus on sex during the fertile period, which is fair enough, right? But then over time, it becomes a pressure for both the husband and wife. For the wife, because it becomes a little bit of a chore. They may suffer from some dryness. Sex is not so pleasurable. For the men as well. I mean, of course, like you said, they get the message saying, hey, tonight, you gotta, get in here. And over time, sometimes they can suffer from some, difficulty maintaining the erection as well. So the sexual relationship of the couple can suffer in the long run. It's very common. It may not be a permanent thing, but that's something that we commonly see. And as doctors, we sometimes also are, may be a cause of causing the sexual health to suffer a little bit as a result of our very detailed instructions.
So having said all of that, right? Life, work, stress, detailed instructions from the doctors, easier said than done, but how do we avoid performance anxiety?
I think it's very difficult to just tell yourself that I'm having sex just for fun, because you know, your body knows that what you're trying for is baby after time and time again. But I think the first thing is to communicate to each other clearly. And the other thing is not to feel down, let's say, on sometimes when you're trying for baby, you're not able to so-called make it for that, that day that you're supposed to be making the baby. Don't get yourself so down. You don't have to have this intercourse perfectly every single time during the ovulation period. That's one thing. The other thing is that maybe outside of the fertile period, give yourself a break. So I mean, just having fun, connecting on non-sexual levels, that can actually help to maintain the relationship and
So you spoke about vagina dryness. What are some things that we can do to prevent that or aid in that?
Definitely arousal, getting, focusing on what's arousing for you. That would be something that's what would actually help, to get
Get things
dryness
moving,
level down.
literally. So I think that's all coming down once again to communication between the couple, speaking to each other, letting each other know what feels good, what you like, how you would like the foreplay to be done for you to be properly relaxed and stimulated. So intimacy, extremely, extremely important. Thank you, Dr. Tan. We will now move on to Dr. Lim. All you need to know about cysts, fibroids, cycles, and PCOS. I think this is extremely common in women. I know maybe it's a company I keep, but a lot of women I know have suffered from this, and myself included. So what exactly are cysts, fibroids, and PCOS?
Okay, so as you've mentioned, Jill, it's a very common topic actually amongst women. So cysts are actually very common. They are fluid-filled sacs in the ovaries. Most of them are actually related to your menstrual cycle. So they're what we call functional cysts or physiological cysts, whereby they actually disappear or resolve on their own after a few menstrual cycles. But of course, some of them, they do persist, and those are what we call, for example, dermoid cysts, and they are formed from the reproductive cells of the ovaries. So dermoid cysts, they can even contain things like oil glands, even tissue like hair as well as teeth sometimes, yeah, and those can grow bigger and will require monitoring or even surgical management. And of course, endometriotic cysts, this is a very big and hot topic right now, especially for fertility. So endometriotic cysts are actually formed from the lining of the uterus. So some of it has gone onto the ovaries to form cysts on the ovaries itself. So in a nutshell, in general, this is what cysts are. Okay, fibroids are actually benign growths of the muscle of the uterus. So they're very, very common. Maybe about 40% of women actually have fibroids. Most of them, women do not even know that they have fibroids until they have done an ultrasound scan for other reasons, and they pick it up incidentally. They may not have any symptoms, and they may also be at different locations on the uterus, causing different types of symptoms. But generally, the idea is that they are benign, meaning they are non-cancerous. PCOS, the other topic is polycystic ovarian syndrome. It is the result probably of imbalance of hormones. Very common as well, 10 to 15% of women have it. Some of the common symptoms would include things like increased hair growth, acne, irregular menstruation, or some women do not even have menses with PCOS. And of course, that will also affect your fertility if you don't have menses and you're not ovulating. In the long run as well, PCOS does have consequences to the cardiovascular health. So a woman with PCOS may have a higher risk of getting things like diabetes and high blood pressure in the future. So it's really important to actually, treat women and educate them about their condition so they know how to manage it better.
Okay, so for PCOS, there are some symptoms that you can see. You mentioned acne and all of that. But what about fibroids and cysts? Are there any visible signs that we can catch early?
Okay, so for most cysts, if they are functional or they're part of your menstrual cycle, they can be quite small. They may not have any symptoms at all. And like I say, you pick them up incidentally on an ultrasound scan. So, but if they are very large, they can actually cause symptoms. So you may experience things like feeling a fullness in your pelvis, some pressure, abdominal pain. And for some women, if the cyst is very large, it can actually twist around its blood supply and cause an emergency called ovarian torsion, where there will be a very sudden, severe pain in the abdomen, which is accompanied by nausea and vomiting. So these are some of the symptoms that a cyst can produce. For fibroids, of course, if they're large, then they can also produce pressure in your pelvis. If they are located sort of anteriorly in the front of the uterus, then they can actually press onto the bladder and cause problems with passing urine. If they're at the back, they can cause problems with passing motion as well. And if they're located near the lining of the uterus or pressing on the lining of the uterus, then they can cause things like heavy menstrual bleeding, for example.
Right, very, very interesting. I think we're all thinking about, oh, do I need to pee? Was it easy to pee? And all of this is leading to something. So is it possible to have more than one of these at the same time?
Yes, definitely, because they're not mutually exclusive. So, there are a lot of women who do present with more than one of these conditions. For example, like I said, fibroids are very, very common. So if you actually were to take a group of women, you'll find that actually half of them may have fibroids.
Right.
Yeah.
And of course, the question that we want to know, should you have fibroids or any of the three that you've mentioned, how does that affect our chances getting pregnant?
Okay, so for cysts, if they are functional and they're small, then they wouldn't affect your fertility at all. However, of course, if you have a particular cyst called endometriosis, then that is something that will potentially affect your fertility because it does cause some anatomical distortions because of the inflammation response that your body produces when you have endometriosis. This can affect your, say, implantation. It can affect your egg quality as well. And for some women, because endometriosis can even cause, dilated tubes and blocked tubes as well. So it can affect your fertility. Although that said, maybe 60% of women with endometriosis, they're able to get pregnant on their own as well.
Oh, wow.
So yeah, so it's really important that even if you have this condition, to not give up hope, and you can still try and get pregnant on your own. And what I would suggest would probably be to actually try having sex regularly, at least for 6 months. And if you have any problems, then you can seek advice from a fertility specialist.
I think that's a great statistic. So endometriosis, 68%.
About 60%, not so accurate. 60.
60,
Yeah.
that's fabulous. You still can get pregnant.
Yeah.
So I have a condition called incompetent cervix. Is that something that can be detected even before pregnancy? So incompetent cervix is basically your cervix prematurely shortens, it's weak. Is there anything that we can do beforehand or get checked?
Okay, so usually you pick that up actually in pregnancy itself when they do scans of the cervix to measure the length of the cervix, and that's when they pick it up. We don't really use the word incompetent cervix these days because it's not something that we usually say. But if you have a pregnancy whereby you have a shortened cervix, in the next pregnancy you can speak to your gynecologist whether you need to do any stitching of the cervix in the earlier part of pregnancy. And it's something, or you could actually get some progesterone tablets as well in the earlier part of pregnancy.
So since many of these, like fibroids and cysts, they don't present outwardly, would you recommend women who are young, who are just married, getting scanned and checked for this beforehand?
Okay, so generally, I mean, if everybody were to go for checks, then they will definitely pick up something. So you'll increase your anxiety levels, it will make you really stressed, and that in turn can also affect your fertility because you don't want to be stressed while you're trying to conceive. So generally what we would say and advice would be if you try having active, like having regular sexual intercourse, if you try it for a year, every 2 to 3 days having sex, then, and you're still not pregnant at the end of it, then definitely you should get a checkup. And this would also include not just having scans to check if you've got fibroids and whether the fibroids are in a location that actually affects your fertility or not, whether you have endometriosis, things like that, as well as sperm checks. Yeah.
That's a lot. Did you say regularly is having sex 2 to 3 times a day, per day?
No. 2 to 3 times, sorry. Every 2 to 3 times, every 2 to 3 days, sorry.
Every 2, well, that's still a lot. Okay, well, thank you so much. We're going to be moving on to Dr. E. All you need to know about sperm and male fertility. So what are some of the common reasons for male subfertility?
Okay, thank you, Jill. So I see a lot of gentlemen in the audience today, and I think it's very good that you are here because contrary to popular belief, men, you are as important as the lady in trying for a baby, okay? So kudos to you. What are the common problems? I think before we know what the problems are, let's have an idea of what men need to do before they can conceive. First, you must be able to have a good enough erection. Then you need to be able to ejaculate. And then within the ejaculate, you must have enough good quality sperm. So what problems can arise then? Erection problems such as erectile dysfunction, or what we commonly known as impotence, can affect people with erectile dysfunction. It's hard even to have regular sexual intercourse. Remember, Dr. Lim was saying once every 2 to 3 days, right? With erectile dysfunction, it's hard to achieve that. And of course, we go on to ejaculatory disorders. Some men have premature ejaculation. Some men have retrograde ejaculation. Retrograde ejaculation is a very not so common condition, but this happens where during ejaculation, the sperm actually goes backward and goes into the bladder and get mixed with the urine. And so you can imagine how with that trajectory path, the sperm is not able to travel into the lady, into the uterus to reach the egg. And of course, we go on to the sperm issues. How do you actually know you have a sperm issue? Usually, it is picked up by having a semen analysis, a sperm test, as what is commonly known. And within the sperm test, there are 4 important parameters that we look at to determine whether or not this sperm sample is good enough. So first, you must have enough volume of ejaculate. Then you must have enough density. Density is the measure of how many sperm present within 1 milliliter of ejaculate. Okay? Then the next would be the motility. Motility refers to how many % of your sperm are fast swimmers. You can imagine the sperm needs to travel a long journey to reach the egg, given that how small the sperm is, and that they have to go through many obstacles. So a fast swimmer is definitely one that gives you a better chance of reaching the egg and meeting and fertilizing the egg. And of course, the last would be morphology, which is commonly known as how many % of your sperm having normal or abnormal shape. And you'll be surprised to know that actually the vast majority of your sperm are shaped abnormally, at least according to the WHO criteria, and that for WHO to term you to have a normal morphology, you must have at least 4% of all your sperm looking and fitting the criteria of normal. So in general, these are the things that men face when they realize that they don't have or they're not able to conceive within a certain period of time.
And when you say within a certain period, what period are we looking at before we should go get checked?
Okay, so generally we look at the age of the woman to decide whether or not how long you are considered to be having problems. So if the lady is less than 35 years old with no other significant conditions such as what Dr. Lim has mentioned before, and with 1 full year of regularly trying, I'm talking about having sex once every 2 to 3 days whenever you're not having the period, then and you're not able to conceive, then you should be getting yourself checked, both the man and the lady. And if you're more than 35 years old and with regular sexual intercourse, within 6 months with no results, I think it's fair to say that you should get yourself checked and to see if there's any issues. Of course, if you're having things like irregular periods, known fibroids, or if the man has got problems with ejaculation or erection, don't wait till the stipulated time to get help. Please just come and see us early so that we can at least have an idea of what we're dealing with, and we can provide the appropriate remedy.
Okay, so under 35, do it naturally for a year. Above 35, 6 months. If you're already experiencing issues, get checked at once. So having said that, what can our male friends expect? What can be done?
Right, so I guess we're talking about improving or optimizing your natural fertility. We always must look at improving our general health right off the bat, because things like obesity, diabetes, hypertension, these are conditions that can affect not just the quality and the quantity of the sperm, it can affect erection or ejaculatory functions of the men. And of course, regular exercising, avoidance of bad habits such as smoking or heavy drinking. And of course, there are some occupational hazards, I guess, that one can't avoid but should try to reduce. If you are constantly under the hot sun, if you are constantly riding a vehicle, you should try to find ways and means to keep your lower regions cool, because a higher temperature can give rise to reduced sperm count and quality.
Okay, so that isn't a myth. So temperature does play a
definitely.
factor. So I know this question is going to come out. I'm just going to ask it for us. Underwear type. What is the optimal underwear type for conception for men?
Okay, so, well, I get this a lot in the clinic. Tight underwear, definitely no go for you if you are trying for pregnancy. Why? Because the tight underwear will keep your testicles very close to your skin and the rest of the body, and that will give rise to a higher scrotal temperature, and we don't want that. The temperature of your genitals should be kept a few degrees lower than your core body temperature. That's the whole reason why a man's testicles are situated away from the body. Okay, so I guess briefs and boxers should be optimal for you if you are trying for pregnancy.
Okay, and finally, where should we go to seek treatment?
Right, so if you have any of the issues, right, not being able to have a firm enough erection, or you think that you're not able to ejaculate properly during sexual intercourse, or if you're just trying for some time and not being able to get pregnant, you can seek help with any of the fertility specialists or your gynecologist. They will advise you on where to get your sperm test done, or if need be, see the specialists in the general hospitals who deals with erection disorders or ejaculation disorders.
All right, thank you, Dr.
Thank
E.
you.
Now, moving along, we've got Dr. Liu, who's going to be speaking about fertility after pregnancy loss, something that I can relate to, something that I feel is very challenging in more ways when is the body ready to try again after pregnancy? Is there a stipulated time? Does it depend how far along you were and when the loss occurred?
There is no magic time and there is no best time. So the best time is now. So when you are physically and emotionally ready after a miscarriage, you can always try. So traditionally, people always say you need to wait 6 months or a year before you try again. But recent data shows that this is not true. So as long as you have fully recovered from the miscarriage and as long as you are healthy physically and emotionally, should be the best time. We say this because the woman's age is important in fertility as well as to calculate the risk of miscarriage. So the older we are, the higher the risk of miscarriage. So that some people will think, oh, maybe I will try in March so that I will get a baby in this month. But life doesn't happen that way. And sometimes if it doesn't happen, then we will celebrate our next birthday. So it's always good to try as soon as possible whenever you're ready.
Yeah, I don't know about everyone here and at home, but I was very caught up with I need to have a baby in this month because of the zodiac sign, and it just adds so much more pressure. It's totally unnecessary. How can couples prepare themselves for a loss? Is that something we should be worrying about, or do we go in with the mind that, okay, it's going to work?
So unfortunately, pregnancies don't always work out well. So 25% of all pregnancies actually end up with miscarriages, whether you have a problem, medical problem, or you're perfectly healthy. So I think you should go in with a positive mindset. It's always very helpful to you, your partner, and your family around you. Okay, you cannot control things you cannot control. Most of the miscarriages will happen because the pregnancy has an abnormal DNA. So this is not within your control. So it happens because when the egg or the sperm splits into two, the DNA becomes unbalanced, and then they result in a pregnancy, but the pregnancy is not healthy. That's why it doesn't continue. However, you really can't prepare yourself for that. So you should just try to get pregnant and be as healthy as you can be, and think positively. I think that will be the most helpful.
So aside from that, again, easier said than done. We lead a very stressful lifestyle. If you're a parent with already children that you've had, splitting your time, how does all of that affect your body, your stress? Is that going to increase a miscarriage, perhaps?
I think it's a very common question. Like, is it the things I do or didn't do that affect whether I can get pregnant or whether the pregnancy will work out? Like what you say, was it because my child didn't sleep all night and now I'm up? And there's a lot of self-blame and self-doubt, especially in a woman. So you need to know, okay, it is not your fault. You didn't do anything, and there's nothing you can do if the pregnancy doesn't work out, because really, really is not within your control. By blaming yourself is very unnecessary, because it makes yourself very stressful. But this is very inherent to us women. So as a man, okay, to prepare yourself emotionally, I always encourage the man to be supportive. Okay, we do neglect the man sometimes. I mean, during fertility and during a pregnancy loss, we always think that the men are okay, but actually they are not okay. They also feel sad and they feel devastated, but they cannot maybe show as much as a woman can. But what you can do to help your wife is you can show her that you are also sad. You can show her that you are also supportive. And if you have a strong and healthy relationship, it helps with getting pregnant, it helps with overcoming a loss, it helps with moving on with your life.
So that once again goes back to intimacy and how important the fundamentals of your relationship and your intimacy is, because I did experience that. After my miscarriage, I had to go to the gynae and he did a scan and he said, okay, your uterus looks fine. Physically, you are okay. Check in with yourself to see if emotionally you are ready. And I'm like, yeah, I'm ready, let's go. And I did talk to my husband about it, and he's like, hey, can we just take it easy? We lost a child. Why aren't you sad? Why don't you act like you're sad? I'm like, I am sad. So you don't realize that, we think men, unfortunately, we treat them as tools in this process. You're just there as a sperm donor, but they have feelings too. And I think throughout the process, even if you are successful, very useful to keep checking in with your partner, regardless of which stage you are at. So after a miscarriage, is your fertility affected?
So fertility is usually not affected after miscarriage, as long as you are healthy and as long as you have controlled your medical conditions. You should just try to get pregnant. However, very rarely, if the pregnancy loss is so significant, like if you have a very severe infection or something that very rarely occurs, okay, then it might affect your fertility. But you cannot go away thinking that, oh, the worst is going to happen to me. I'm going to have scarring of the womb because I had a miscarriage, that's why I cannot get pregnant. I think you should not overthink. You should try to get pregnant, and if we have a problem eventually, we will deal with it. But this is very rare. Most of the time, a miscarriage is a one-off event, and your next pregnancy is usually going to be successful.
So having said that, I think some of the myths are, yes, once you have a miscarriage, you try it once, you will get pregnant. And you'll get pregnant with twins. Is there any truth to that?
You know, I've not heard that before, like getting pregnant with twins. Yeah, but you know, this is the mindset of a lot of people. Like, I want to get pregnant. So I always tell people, if you're feeling very unwell now, you're not in a good place, you're feeling very stressed, by being pregnant again, it's not going to make it better. Even if the pregnancy is successful, you know, it's very, very difficult, and it's very, whatever stress you have, it will be elevated when you're pregnant, even if it's successful.
That is very, very true, because like I said, right after my miscarriage, I tried again at once and I got pregnant, and just the paranoia is like, oh no, is this going to happen again? Is it going to take? And any like slight moist feeling of it, oh, it's happening again. So yeah, I think that's very important that you brought that up. So thank you, doctors, for all you've contributed so far. We're going to open up the questions from our studio audience who have already contributed through the form, as well as everybody on joining us on Zoom. We've got a little Q&A there as well, so feel free to keep your questions coming. First question is for Dr. E. Will drinking iced green tea decrease the amount of sperm? No silly questions, all very valid questions tonight.
It's a very specific question, but I think there are two parts to it. Some patients do ask, well, if I drink a lot of ice drinks, will that affect my sperm quality? There hasn't been any evidence for or against this, so I don't think that's going to be an issue. Now, green tea, if you're talking about green tea in large amounts where it contains a lot of caffeine, then maybe, possibly, but if you're not drinking a lot, then I don't think it's going to affect you in any adverse manner. So same goes for any beverages. If you are drinking small, moderate amounts and you're not taking anything that's like contains steroids or medicines or hormones. Because I do know of some patients who take some supposed energy drinks from their friends which might contain some steroids or hormones, and that definitely will affect the sperm count and quality. But
what about like protein shakes? If you're working out and you're already taking protein shakes, will that affect anything?
No, protein shakes, no issues, but definitely not the anabolic steroids or the testosterones and stuff like that, which I do see in some people who does bodybuilding. But in general, iced green tea sounds delicious. I don't think you should be too worried.
Awesome. Okay, so Dr. Liu, would a prior abortion, let's say within the first trimester, affect chances of conceiving?
So I would think that the question refers to termination of pregnancy, like washing of the uterus. But we do it if you have a miscarriage also. So anytime you wash your uterus, it is the same process, be it whether it is for social reason or whether the pregnancy fails. If the procedure is done well and there's no complications, usually it doesn't affect fertility. However, if you have repeated washings, repeated terminations of pregnancy, then the risk of you having scar in the lining will be higher, and that will affect fertility. So as a routine, before any fertility treatment in the place where I work, like IUI and IVF, we always check the womb lining to make sure that you don't have a scar before we embark on a fertility treatment, because if that happens, we need to deal with it. Then it can make the pregnancy outcome better.
So let's say multiple abortions or terminations, and multiple miscarriages, when should we get checked? Are they the same process? If you have multiple miscarriages, are you more likely to have scarring in your uterus?
I think specific to scarring, it is the same. Having a termination or evacuation for miscarriage, there is no difference, but the reason is different. So if you have recurrent miscarriages, then we are not just dealing with scarring of the womb lining, but we want to think about, is there anything other that is contributing to the repeated miscarriages? So this is not common by chance. So if you have one miscarriage, it's probably by chance. But if you have 3 or more miscarriages, the chance of you having it based on luck alone is about 0.00%. Okay, but yet we know that 1 to 2% of women do suffer from recurrent miscarriages. So if you have repeated miscarriages, my advice is you should see a gynecologist to do some tests to see if there's any other thing wrong with that we can deal with before we get pregnant again.
Got it. Okay, so next up's for Dr. Tan. My wife frequently gets light spotting a couple of days after sex. Does this mean implantation has failed?
So in general, this is not a sign that implantation has failed. What it actually, okay, the main thing that we should exclude is there's no abnormalities in the cervix. The cervix is the opening of the womb. So imagine when a penis goes into the vagina, that's what it's actually in contact with. So when you have bleeding after intercourse, the main thing that you need to make sure that it's not happening is that you don't have any abnormalities inside your cervix or your vagina. So I would suggest to see a gynecologist to do a vaginal check. That would involve something like a little plastic instrument being put into the vagina to inspect the opening of the womb, which is the cervix. So at the same then, what can be happening inside your cervix could be, for example, little growths such as polyps on the cervix that's causing this bleeding. The other thing that's very important is that to make sure there is no signs of early cervical cancer. Thus, at the same time, it will be a good opportunity for your gynecologist to do the pap smear for you. And I would also suggest to, at the same time, consider getting a pelvic ultrasound to make sure that the womb lining doesn't have other growths such as uterine polyps, which could also cause bleeding outside of your menstrual cycle.
Moving on, so what is the recommended number of folic acid pills when you purchase it at the usual drugstore to be taken a day, Dr. Lim? Because I have the same problem as well. I go there, the grammage is different, so I'm like, oh, how much is too much?
Yeah, so generally, if you take more than 0.4 milligrams of folic acid a day, that would be sufficient. In our hospitals, I think we stock 5 milligrams, so that's what we routinely give our patients, and that is also fine. So as long as you look at the back of the pill bottle and you see that it's more than 0.4 milligrams, then you're safe.
Is there such thing as taking too much?
I think it's fine, yeah.
Okay, great. So Dr. E, as a male, what kind of food should we be avoiding to ensure that sperm fertility is good?
Well, I think that's a very good question. I don't know, man is often neglected, right? So men, you need to take good care of yourself, take good care of your health, eat healthily, healthy balanced diet, ensure that you are of a good BMI. And in general, we always suggest that men eat food that are rich in vitamin A, C, D, E, things like coenzyme Q10, like fish oil, DHA. So generally, these are antioxidants, and these help to reduce the abnormalities in sperm, and they also help with hormone levels. But you don't have to search high and low to find foods that are specific to this. And I know some men who will eat a lot of oysters because they were told it's rich in zinc and selenium. Well, it's true, but I think eating too much of oysters can be quite detrimental to health too. So everything in moderation. And of course, if it's too difficult, can just buy off any pharmacies those supplements which contain most of this that are advertised for men's health. I also get asked a lot of whether we should try traditional Chinese medicine or other types of traditional medicine. I really don't think there's any harm of trying, and I have heard of people who have done well on traditional medicines. Of course, please go to the physicians who are reputable and definitely know what they're doing. In fact, in my own hospital, we are also doing a trial on traditional Chinese medicine and their effect on male fertility and how much it helps, just to see what is the change it does, a perceivable, quantifiable improvement in the sperm parameters. So in general, I would say that keep a healthy, balanced lifestyle. If you need to, you can get some supplements, and it's never wrong to seek second opinion from the traditional medicine point of view.
And speaking of fertility consultations and TCM fertility consultations, this is where you can join us again next Friday on the 10th of March. If you haven't already registered, you can do so www.ilovechildren.sg, because we'll be having the doctors from Thompson Chinese Medicine and TCM fertility consultations with us to answer more of your questions. You could also walk away with fertility consultations worth up to $400, as well as an acupuncture session and more TCM fertility consultations worth $200, okay? So if you have not done so, join us again next week for more on TCM. Back to the questions here. For small polyps, does it need to be removed? And if yes, is the surgery optional, Dr. Lim?
Okay, so for polyps, for those who don't know, it's actually like a little small growth or a skin tag on the lining of the uterus. Okay, so when you're talking about small polyps, 5 mm was what was quoted in the question. So that is really quite small. Sometimes we diagnose this based on ultrasound scans, and then someone tells you, oh, you've got a very small 0.5 cm polyp. Sometimes it could just be, a folding of the uterine lining. It could just be something that when you scan again in 3 months' time, it might actually disappear. So sometimes with such small polyps, we actually don't really advise you to actually get it removed, because yes, removal would require surgery, and this would be putting a camera called a hysteroscope into the vagina and into the uterus, and then from there we will use instruments to cut the polyp out and then do a light scraping of the uterine lining for testing as well. So usually if you think about polyps, if they are large polyps or they are rapidly growing, then you might consider taking them out. If they're more than a cm, for example, and they're growing, then yes, surgery would be a possibility to actually try and remove it. It may affect implantation. We still don't know if it really does at this moment. Yeah.
Okay, thank you. So next question. A couple have already successfully had a first child, and they're trying for the second, but they've been doing so for 15 months, as well as taking ovulation pills prescribed from their doctors, but they're still not successful. Should they be investigating further? What do you think could be the cause, Dr. Liu?
Okay, so most of the couples come to us when they don't have any children, and this is called primary subfertility. When you have one child and it takes a little bit longer to get a second child, that is called secondary subfertility. So this is secondary subfertility, and it's quite commonly seen in our clinics. I think if you have been trying for 15 months, it's worthwhile to do further checks, because fertility is not just about ovulation. Just eating ovulation pills doesn't guarantee you pregnancy. There could be other reasons like blocked tube, poor sperm count, or there's no reason. 1/3 of our couples that we see in fertility clinic actually are unexplained. Okay, with a little bit of help, maybe with IUI or even IVF, if you do qualify, it can reduce the pregnancy interval. That means it will get you pregnant faster. Having said that, even if you are considering fertility treatment, you should continue to try regular natural pregnancy, because while waiting for the investigations to be done or while waiting for fertility treatments to be done, you can get pregnant.
Okay, so Dr. Tan, the next one is for you. Is it normal for women to have fluid discharge after intercourse? Does that mean the sperm is leaking, the semen is leaking out?
So this is a very common question that I get asked, because a lot of ladies are concerned that after having sex, the semen flows out. I mean, and it does. And this is actually, I can assure you that this is very common and it's normal, right? I mean, a lot of women are so anxious to keep that precious semen inside. They will, elevate their backside and on a high pillow, for ages and ages.
Yes,
so,
I've done that.
Yeah.
Guilty.
It's understandable. I mean, it's perfectly understandable. There's even devices now that's on the market which will so-called plug up the semen from flowing out.
I wanted to get that.
Okay, so it is perfectly understandable that this concern with getting the sperm inside and keeping it in, but just to assure you that it's normal for the semen to flow out, and the chance of pregnancy is actually not reduced, And doing these practices, such as keep the semen in, does not actually increase the chance of pregnancy. However, if it makes you feel better, it doesn't, like for example, it doesn't cause you any harm. Like you're not causing yourself UTI by just, not going to the toilet afterwards. I mean, that's fine. You can do it. It's perfectly fine.
Okay, so to answer the question, it is normal and it does not affect the chances of getting pregnant. Very good to know. Very good to know. Dr. Lim, I was taking Visane for 1.5 years after removal of endometriosis cysts. Now that we are ready to start a family, I have stopped and menses has resumed. Does that affect the quality of my eggs and does it affect my fertility? Will the cyst form again now that menses has resumed?
Okay, there's a lot of questions in one question. So yes, endometriosis, as I've mentioned earlier, does affect the quality of the eggs purely because of the fact that it produces a very sort of inflammatory condition in the pelvis itself, which is where your ovaries are and that's where your eggs are. So it does affect the quality of your eggs if you have endometriosis. And the fact that the question it's assumed that there were endometriotic cysts that were removed. So with every surgery that involves removal of cysts, inadvertently some of the ovarian tissue that contains the eggs will also be removed as part of the surgery. So definitely the ovarian reserve would have reduced with the surgery being performed. Endometriosis, even if you remove the cysts and you take Visane, the rate of recurrence can be quite high, and depends on how bad the endometriosis was in the first place and how good the clearance was performed during the first or initial surgery. So we actually quote the risk of recurrence can even go up to 50% or even higher sometimes. So yes, if you stop your medical treatment, cysts can form again, but you do have to stop your medical treatment to actually try and conceive. So it's really a balance between what you want in terms of whether you want to control your symptoms, control your endometriosis versus trying to get pregnant. So of course, age is always a factor that we always keep in mind. So if you are getting older and you want to try for pregnancy, then please go ahead with that and stop the Visane. And we'll just monitor the cysts with ultrasound scans. And seek fertility advice. 6 months.
6 months, okay.
Yes.
So I hope that answers the question. And of course, what we're promoting tonight is positive mindset. You can get pregnant. You will get pregnant. We can do this. Just get checked out early. So for poor sperm morphology, I hope I'm saying that right.
Very good.
Is there
Morphology.
any way to improve it, Dr. E?
Okay, so I think I've drummed on enough about keeping yourself healthy, eating healthily, keeping clear of the chronic illnesses like diabetes, high blood pressure, and things like that, and taking food or supplements that are rich in vitamin A, C, D, E, zinc, selenium, and stuff. One other thing that I get asked a lot is how much or how often should we clear the sperm before we make love. So some people feel that, I want to store my sperm for 1 month before I unleash it at one go, so that will be the maximum power, right? So that's actually a misconception. So if you have abstinence for 1 or 2 weeks, right? The problem is the sperm that's stored within your testicles, they are 1 or 2 weeks old. A lot of them will lose their motility. A lot of them will lose their vitality, and they won't be swimming that well. On the contrary, if you clear your sperm regularly enough, once every 2 to 3 days, those are the fresh young sperms, right? As those will be the ones that will swim the furthest, and hopefully the improve your morphology and motility of the sperm. Of course, I'm talking about people with normal sperm count to begin with. But if your sperm count is low to begin with, then I think trying to improve morphology shouldn't be the first thing that you're thinking about. You should try to improve the count altogether. And should you not be successful in trying to improve count, then you should be thinking about assisted reproductive therapy like perhaps IUI, depending on how low the sperm is, or IVF, which should represent your shortest chance to achieve a pregnancy.
I think that's very interesting and useful because, you know, as women, we track our periods, we track our ovulation. For men, you should be tracking how often you've cleared your inventory
Yeah.
and when is the best time to try again. Okay, very good. I hope we're all paying attention in studio as well as at home. Keep that in mind. So, Dr. Tan, how can we avoid performance anxiety? I know a lot of us think, okay, we have a little bit of alcohol, it's going to loosen us up. Does that have any effect on quality of things?
Generally, I'll say that having alcohol would not improve your chances of pregnancy when you're trying to conceive, or But if you, in terms of avoiding performance anxiety, I would say that actually the best way is then not to put yourself in that situation, which means that not to put yourself in a situation where you'll be so anxious that you have to, you're trying to conceive on that very day. So studies have actually also shown that when people are trying to pinpoint the exact day to that they think they're going to ovulate and conceive, in fact, it's often missed. So actually the other way that I would suggest is to try to have regular intercourse, which is intercourse probably every 2 to 3 days during your fertile period. So regardless of which day your ovulation happens, you should so-called cover your bases. So the fertile period, a lot of people use their apps nowadays to calculate for them, but for others who are not aware of what the fertile window is like, in a lady with a 28-day cycle menses, generally that would be something like, maybe say day 6, maybe say from day 8 to day 14 of their menstrual cycle, something like that would be.
I personally used an app as well as Clear Blue's ovulation strips to find out what my ovulation period was. And could you talk a little bit more about the ovulation window? Because some women are ovulating for 2-3 days, some are just a couple of hours. So how do we track that? Is that something that we should be bearing in mind?
So if you track that is a thing. The studies have actually shown that actually when you try to track the ovulation itself, sometimes it can be missed despite using very technology such as urine test kits. So I mean, so it depends on how you think about it. If you think that for you tracking your ovulation, so you know that okay, firstly I ovulate, I'm happy that I'm healthy. Secondly, I know that okay, this few days are the best days for me to try. The rest of the times will make me. The rest of the times I can just relax. That's fine. For other people, in fact, this kind of micromanagement of their ovulation could actually make them more anxious. In which case, like I mentioned just now, I would recommend just to try to have intercourse every 2 to 3 days during the fertile period. So different strokes for different folks. Yeah.
All right. Dr. Lim, we have a question from a woman who's just turned 40. She would like to try for her first child, but she was recently diagnosed with endometriosis, which resulted in a large cyst and a fibroid. Some of the risk of surgery include reduced ovarian tissue. Should she proceed with the surgery?
Okay, so pertinent to this question is how large is the cyst? Is it causing any symptoms, for example? And on ultrasound scan, are there any suspicious findings? Because if there is, then yes, maybe you should proceed with the surgery. However, bearing in mind, like I mentioned earlier, it does reduce your ovarian reserve. If you're turning nearly 40, then your ovarian reserve is already decreasing already. So it might be worth to check your ovarian reserve either through a blood test or through a scan on day 2 to 4 of your menses to count the number of follicles before you go for the surgery, so you have a better idea of what is going to happen after the surgery.
Very nice. Okay, so Dr. E, back to you. You mentioned IUI. How much does that cost in Singapore, and what are the chances? How does that increase pregnancy?
Okay, I don't think I can answer for other centers, but in our center in KK Hospital, IUI generally costs between $1,000 to $3,000, and it also depends on the type of IUI that you are undergoing. So it can be a medicated or a non-medicated IUI. So that will differ in terms of, that will result in a difference in cost of the IUI and also the success rates. So generally we quote a 5 to 15% success rates for IUI, depending on what you choose, the type of IUI you're undergoing.
All right, we will leave the chart up a little bit longer so everyone can take note of it, take a picture if you want.
Can we go to the slide before that? So there's also funding, co-funding. If you're not aware of that, there's also co-funding for IUI for Singaporean couples in the restructured hospitals like KK, SGH, and NUH. I think this is the slide for the IVF. The slide before shows
the previous slide,
the
please.
previous slide.
Yeah, this one.
Yes. No, the one before that. This is for IVF as well.
Anyway, for Singaporean is a $700 grant. For $1,000 grant. Singaporean PR is 700, and Singaporean with a foreigner is a $500 Singapore grant. The rest you can use MediSave to pay.
Okay, very, very useful. I'm sure we can find more information on our respective websites as well. While making appointments to see a gynae for fertility, let's say in KKH, do we need to register both husband and wife or just the wife, Dr. Liu?
So you need to register the wife, but the husband will be encouraged to come. Even if the husband doesn't come, we will order some tests for the husband through the wife's account. And if the man needs further help to see the urologist or andrologist, we will refer them from there.
And likewise for Dr. E, can a man go for the checkups for fertility by himself, or does he have to be with a partner?
Oh, if the guy has a problem, definitely they can go themselves, and depending on where you go. In KK, generally we see the couple together, so we will encourage the couple to come together, because it's very, very difficult to determine why a couple is not getting pregnant just based on one person, because it takes two hands to clap. You know that, yeah.
So that's what we're reinforcing tonight. You guys are a team, and from our poll, we have seen that the majority of us tonight are couples who have come together. So remember that. If you're going to get checked out, if you feel there's anything wrong, you might as well, as a team, go down, both get checked out together. So Dr. Lim, can PCOS be treated? Should I be concerned despite it being common? And how does this affect my chances of fertility? Many questions
Yes,
again.
I always get many questions in one sentence. Yes, PCOS, I mean, it can't really be treated on its own, but what we're looking at would be the symptoms that PCOS presents with. So for example, if you're having irregular menses, really important to actually have menses at least 3 to 4 times a year, because this prevents the menses, the lining, from actually changing to a precancerous changes in the long run. So you need to take contraceptive pills or hormonal pills to actually induce your menses, all right? And also you should approach this as a holistic view, like holistic way. Good BMI, if you have high BMI, to lose some weight, it will help you regulate your menses, and as well as reduce your cardiovascular risk in the future. And very importantly, for fertility-wise, if you're not having your regular menses, you're not actually ovulating, and if you're not ovulating to release an egg, then generally this will affect your fertility. So you can actually seek advice and get ovulation medication, for example, from your fertility specialist.
Well, thank you. So Dr. E, you mentioned that tests should be done if conception does not materialize within a year for women below 35. Does this timeline also apply if a woman conceives but then suffers a miscarriage, or does successful conception mean that both are fertile?
I think the definition of fertility is very subjective. So as long as you feel that it is time to see a doctor, I don't think that's a wrong time. Seeing us doesn't mean we want to offer you treatment. We might just tell you everything is okay and go home and try some more. Okay, but you can come to us so that in case there are any issues that we need to deal with, we can solve it or try to help earlier.
And this next one is for Dr. Lim and Dr. E. We already know vitamins A, C, D, E, but specifically what kind of food or fruit can increase fertility, and will alcohol affect the sperm quality and performance?
I'm going to go first. So we're talking about foods that are rich in antioxidants. You're talking like cranberries. You're talking about fruits like citrus fruits, and also the dark leafy vegetables. And of course, seafood like shellfish, oysters, those are rich in zinc and selenium. Those are all ingredients for good sperm production. Alcohol-wise, of course, one glass of wine and then dinner no issue. But if you're a binge drinker, alcohol definitely will affect many aspects of a man's health, such as the ability to have a hard enough erection, a proper ejaculation, and it will also affect the quality and quantity of the sperm. So definitely, if you're thinking of trying for pregnancy, maybe just limiting your alcohol intake to minimum would be a good start.
Anything to add
I
on?
mean, for females, generally, I mean, it's just to have a very healthy diet, eat plenty of your fruits and vegetables, nothing specific. And of course, moderation is the key word. Moderation in terms of alcohol, caffeine use, etc., will help you with your fertility.
Okay, so what is good for the goose, good for the gander, healthy all round. Will having sex after ovulation affect implantation, Dr. Tan?
Okay, so there's another question which I'll answer at the same time, because the question is, after ovulation, how many days should you stop trying until the next cycle? So I think I'll answer both these questions together, because basically having sex after ovulation does not affect implantation. You can go on having sex for the rest of the menstrual cycle.
Okay. Will sperm quality be affected if we are having sexual intercourse with ejaculation as often as once every 2 to 3 days?
Well,
Dr.
that's
E.
actually what we want you guys to do, right? Have sex once every 2 to 3 days. Simply because of the notion that if you abstain for too long, the sperm that's stored within the testicles, they will be older, they will be slower, they'll be less energetic, and that would result in reduced morphology and motility. And we do see that in semen analysis, which is why we always ensure that before the man comes for a sperm test, they need to have just 3 days of abstinence, no more than that, and that will give us the most interpretable result in terms of how good the sperm are.
Perhaps quantity-wise, would that affect the quantity that...
Generally, if your quantity is not an issue in the first place, then no, it's not a problem. But of course, if I said just now, if the quantity, if the sperm count was low to begin with, then maybe it's not just about having sex once every 2 to 3 days. You should be seeking help from a doctor to see what's the next best solution.
Okay, so for Dr. Lim, how to know you're ovulating if you have irregular periods? I think this is something that is a lot trickier for women.
Yeah. So if you're having irregular periods, it'll be very hard to determine when you're ovulating. So that is why we always say have sex every 2 to 3 days, so that no matter when you're ovulating, there will be sperm there to meet the egg. So it doesn't matter when you actually ovulate. Yeah, there's a general advice we give for women with irregular periods.
So basically, just have fun in the process of doing it?
Yeah, of course.
Okay, very good. Does heart medication and cholesterol and blood thinners affect fertility? Yes, other medications, Dr. E.
Okay, so I'm assuming you're asking if these medications affect sperm health. So I think, again, we have to look at two aspects of this question. If you're already having a high cholesterol problem, a high hypertension problem, heart problem, now these issues itself, if not well controlled, will have a detrimental effect on the sperm health. And so I wouldn't advise you to stop taking your cholesterol medicines or blood thinners in order to try to have baby. Absolutely not. Okay, but what we do know that some medications like hypertension medicines and stuff like that can have an effect on your ability to have arousal, ability to have a firm erection. So that can sometimes hinder your endeavors to have a child. But I think the more important thing is to make sure that the baseline health is well looked after before you can even think about trying for a kid.
Okay, very good. So aside from questions about trying to conceive, if you have already conceived, please send your questions in as well. We have one from someone who has successfully conceived. Congratulations. Is it okay to travel overseas in the first trimester? I've been told it's usually better to go in the second. Dr. Lim.
I mean, a lot of people say it's better to travel in the second trimester because the pregnancy is more stable, so they feel more comfortable and more confident traveling in the second trimester. But it's actually okay to travel during the first trimester as well. Just make sure that you are not having abdominal pain, you don't have any bleeding, the pregnancy is the right place, you've had your scans, and you're doing the right things. Remember, when you're pregnant as well, you are at a higher risk of getting blood clots in your legs. So for example, if you are traveling, taking a long plane journey to New York, for example, is 19 hours, then make sure that you keep yourself well hydrated, you drink plenty of fluids, walk around the cabin, and just try and prevent yourself from getting blood clots, and make sure that you have all your information with you if you were to go overseas. Other than that, it should be fun. Just go and have fun before you actually
Have the child.
have the child.
Okay. Does sex enhancement pills like Viagra help to get intercourse going? Does it affect sperm as well? Dr. Tan first.
Joe, I might pass this question over to Dr. E.
Okay, Dr. E.
Oh yeah, so I do have some of my patients using pills like Viagra. So basically, this is a pill that helps erectile dysfunction specifically, and for the sole reason of being able to achieve hard enough erection so that, again, sexual intercourse and penetration, successful penetration can take place. So definitely, if your issue was that of an erectile dysfunction, then yes. But if you don't have an erectile dysfunction issue, you are having sex regularly with no problems, then I don't think taking Viagra will improve your conception chances, other than maybe improving the sexual performance. That's it.
Okay, next question. Tricky word there. Varicocels?
Yes.
All right, Dr. E. Once again, varicocels affect fertility for males, and how would they know if they have it? When should they get checked?
Okay, so this question we see a lot. Okay, so varicocele is actually a condition whereby the blood vessels in the testes are dilated, and it is associated with reduced sperm count and motility and also morphology. So in the past, it was recommended to get surgery to get rid of the varicocele, but studies have shown that varicocelectomy, if it's done, may help to improve sperm parameters, but it has not been shown in studies to improve live birth rates. Okay, so what's happening now is that if we see varicoceles, most people would have mild varicoceles, and you won't even know it. It's usually diagnosed if you undergo an ultrasound scan of your scrotum. But if we see that the varicoceles are significant enough or serious enough, then we may refer you to a urologist to perform a varicocelectomy in a bid to try to improve the sperm parameters.
All right, thank you. So, Dr. Lim, will exercising during pregnancy at any stage increase the chance of miscarriage?
Actually, now we encourage everyone to be more active during pregnancy and to carry out your regular aerobic exercises if possible. Of course, avoid things like scuba diving for those scuba diving enthusiasts out there, and of course contact sports, for example, because that can actually cause more harm than good.
Okay, Dr. Tan, help me out with this one. How to cure
Vaginismus?
vaginismus for females other than physiotherapy?
Okay, so for those who are not aware, vaginismus is a condition which affects ladies. It is a form of female sexual dysfunction. So these ladies actually suffer from recurrent severe pain when anything attempts to enter the vagina. Right? So this is an actual medical condition. So one of the cornerstones of treatment for this condition is physiotherapy, because it is essential for physiotherapy to help to teach the muscles to relax. Other ways to actually assist to cure this condition would be psychotherapy, as well as counseling, relationship counseling to help communication between the couple.
Very, very interesting. Okay, Dr. Lim, if I have large blood clots during my period, along with painful, heavy periods, would it affect my fertility? Is there anything I can do to improve the situation?
Okay, definitely get yourself checked up. Go to a gynecologist, trusted gynecologist, get a scan, see if there's anything with the uterus or anything like adenomyosis or endometriosis that could be the cause of your symptoms. And then we'll take things from there because it depends on what you have, whether it does affect your fertility or not. So just get yourself checked up.
And Dr. E, masturbation, does it affect the sperm count?
Okay, so masturbation itself does not affect the sperm count, but we've been talking about once every 2 to 3 days. Sometimes it's not that possible for couples to have sex once every 2 to 3 days, but maybe using masturbation to clear sperm can help with keeping your sperms fresh and recharged. So I don't think masturbation itself has got any effect on the sperm count. Of course, if you are talking about masturbating 2 to 3 times a day, then that definitely would have an effect on the sperm count when you really do need it. So the act of masturbation itself, no.
Okay, good to know. And Dr. Tan, any specific sex positions for optimal conception?
Okay, so I've been asked that. I mean, some people actually ask this question, like whether they think woman on top is bad, rear entry is better to help the sperm get closer to the cervix to swim to the eggs. I mean, again, whatever is preferred by the couple is fine, but again, there's no medical evidence that any position is superior to others.
All right. Sorry. If this is for Dr. Lim, if I have PCOS that resulted in irregular heavy menses that has been treated through surgery and the use of hormone pills, now with regular menses and ovulation, is it possible that the irregular menses can return after I stop taking the hormone pills, and would ovulation then be affected?
Right. Probably you're having regular menses because you're taking the hormone pills. So I'm presuming the hormone pills that you're taking are actually either the birth control pills that you're taking to actually allow your menses to be regulated. If that's the case, then that actually acts as a birth control. So then you will not be able to get pregnant with that. So it really depends on what hormone pills you're taking. And if you stop taking the hormone pills, you're getting back your regular menses, then likely you're ovulating, so that shouldn't affect you. So I think the question, we need to explore that a little bit more. Yeah.
Okay, so feel free to retype that, get into more detail. Dr. Tan, anything to take note of before, during, and after intercourse while trying to conceive?
I think if you're taking notes during intercourse, then I think that is definitely something that's going to reduce the pleasure during the process. I would actually advise you not to focus so much on ensuring that penetrative intercourse takes place all the time. Like I've seen couples who actually conceive even when the penis is actually just at the opening of the vagina. The sperm has a way of getting its way there.
Does having an orgasm increase the likeliness of conception?
So again, laboratory studies have shown that orgasm can actually help the sperm be transported better, but however, in humans again, it doesn't increase the chance of pregnancy. However, I say again, orgasm is good, so go for it.
Yes, sit with conviction, orgasms are good. If you have a retroverted uterus, would it affect your fertility? What do you need to specifically do to get pregnant, Dr. Lim?
Retroverted uterus are actually a normal finding as well. So it shouldn't affect your fertility unless there are other reasons like endometriosis, for example, that's actually causing your uterus to be put back and retroverted. So the sperm, like my colleagues have been saying, can swim. So no matter how retroverted it is, it will get there. So nothing you need to do specially.
Okay, and a follow-up to that, this person has had irregular periods, taken a test by doctors. Nothing is wrong, it's just hormone imbalance, and they've started taking birth control pills to regulate their period, but is scared that once they stop taking the pills, the problems of conceiving will start. When do they decide to have a family, and what should they do?
Right. Just advice is just stop the pills, see what happens, wait for your menses to come, and then just try have regular sexual intercourse every 2 to 3 days, like we've been drumming into everybody, and then see how it goes. If really you're not getting your periods or you're having trouble conceiving, then please seek advice from the fertility specialist.
And Dr. E, I've actually heard this. Does bicycle riding hurt the sperm and affect fertility?
Okay, so by and large, it doesn't. Okay, I have known of many avid cyclists who have plenty of children, right? So I really don't think so. But if you have some issues with your sperm to begin with, and you cycle really a lot, like long rides around the island types of cycling, then yes, because just by the pure fact that the position of the testis is in that area, and usually you're wearing tight clothing, right? So the temperature, the scrotal temperature is going to be affected. So if your sperm is already borderline to begin with, and that might reduce it further. But for the vast majority, generally no issue. I know a lot of people who cycle a lot, and they have no issues with that.
All right, very nice. Dr. Liu, gosh, these words, had an ectopic pregnancy with,
Self-injectomy.
there we go, Presidia. Will this increase chance for another ectopic pregnancy or affect fertility? And what are the chances of having a normal pregnancy after that?
So an ectopic pregnancy is a pregnancy outside of the womb, and if it's in a tube, we'll remove the tube if it cannot be saved. So that is called a self-injectomy. If you have one less tube, if your other tube is still functional, you can still get pregnant naturally. However, if you already have a history of ectopic pregnancy, definitely your risk will be higher than the general population. Having said that, the chance of you having an intrauterine pregnancy, that means pregnancy inside the uterus, is higher than that of you having another ectopic pregnancy. If you have both tubes removed or one removed, one blocked for whatever reason, then you can still get pregnant, but you need IVF to get pregnant. Having said that, IVF doesn't eliminate the risk of having an ectopic pregnancy. So if you have an IVF pregnancy, it can swim from the uterus and go into the tube and become an ectopic pregnancy also.
Okay, but that's good to know that even if your tubes are blocked, you still can get pregnant with the help of IVF. Sticking with Dr. Liu first, is sitting too long, let's say 8 to 12 hours a day, cause infertility or miscarriage?
I don't think so, but there are other implications for sitting too long. So if you sit very long, you snack a lot, you don't walk a lot, and you put on weight. I think the implications will be more. So we will advise you to maybe take some breaks, move around. If you can't, then don't snack and be active when you can.
Okay, so Dr. Tan, another sexual intimacy question. How long should the duration of sex be, and should we lie down with a pillow under our backs, legs up? Any of that true?
No medical evidence, but I mean, if you feel like doing it, it's fine.
Period, 10 minutes, half an hour, how long should we be having sex for?
I mean, for the purpose of conceiving, as long as the semen is actually, in the vagina, that's good enough. It doesn't have to be a very prolonged period of time.
That's great. Just personal question. If, let's say, my husband ejaculated into a syringe, does that work as well, or do we have to have sex?
It works as well. So.
Okay, so good to know in case you're too tired. Okay, women, we got a lot of things to do. Other than IUI and IVF, is there any other options to increase the chance of fertility, Dr. E?
Again, I'm assuming this is pertaining to the men's fertility issue, and it depends on what's the problem per se. If it is an erection problem, and you could do the syringe method, you could just ejaculate into a bottle and then syringe it into your partner's vagina, so that will bypass the problem of having a hard enough erection to achieve penetration. But of course, if the sperm count is very, very low, or the motility is very, very poor, then assisted reproductive therapy would be the more appropriate channel to get at. In general, we always want to improve the natural fertility of men by having a healthy lifestyle, eating the appropriate foods, avoiding all the things that we've spoken about just now, and all those would increase our chance of fertility. But I guess it has to be a little bit more specific to know what's the problem before we try to tackle how we can improve
Got it. So, questions for Dr. Lim now. Does yeast infections, which is very common in women, does that affect chances of conceiving?
No, it shouldn't affect the chance of conceiving unless it's really uncomfortable and you don't want to have sex, then yes, it will.
And under what scenario should we consider removing an ovarian cyst?
Okay, so if the ovarian cyst is causing you symptoms, for example, it's really large, it's causing you pain, there's a large risk of rupture, for example, or if the ultrasound scan shows that there are suspicious findings, then yes, of course, please remove the ovarian cyst. And remembering that if you have a large ovarian cyst, there's also a risk of something called ovarian torsion, which is the twisting of the cyst around its blood supply that can cause a lot of pain as well. So in these scenarios, it will be really important to actually consider removing the ovarian cyst.
And Dr. Tan, what can we do about vagina dryness?
Okay. So for reproductive age ladies, so the estrogen level in our bodies are actually quite sufficient to keep us moisturized if there is enough foreplay. Right? However, if you wish to use external lubrication, lubrication gel is fine, which is applied during sex. The other one is vagina moisturizers that's applied inside the vagina, outside of the sexual times.
Oh, did not know that. Vagina moisturizer, learning so many things today. One quick question as well. So I have a friend who has had her gallbladder removed, and that affects hormone levels as well. So let's say you've had a procedure like that, how does that affect your chances of conception? To whichever doctor can answer that.
I'm not so sure if the removal of gallbladder will affect fertility. I think your friend shouldn't be stressed. She should be able to get pregnant if she doesn't have any fertility issues. And she can get pregnant as soon as possible.
Okay, I will let her know. Dr. E, could you share a little bit more about the medication and intervention options for men that are unable to ejaculate?
Okay, so ejaculation issues are quite wide, and a lot of times is actually closely related to erectile dysfunction. So a lot of times we try to get them to have a hard enough erection by prescribing medicine like Viagra, and to see with a high enough erection, are they able to ejaculate then. Of course, there are some people who have retrograde ejaculation, so we also have medicine to do that, to try to block off the muscles of the bladder so that the sperm actually goes the right way. And of course, if there's nothing the man does that is able to help him achieve ejaculation, he can undergo a surgery where we use electrical impulses to help achieve ejaculation, but that's under anesthesia.
Okay, well, I hope we've answered that question. Now, once again, a reminder, if you have not filled out your feedback forms, for those of you joining us virtually, do that right after the seminar. You could be walking away with a gift packet from Clear Blue worth over $100. Terms apply there. And for those Escape as well, in our studio right now, remember to go collect your gift pack at our registration. And for next week, join us again on Friday for the fertility consultation and TCM fertility consultation happening here. You can visit www.ilovechildren.sg, register there. A lot of goodness happening as well. Once again, thank you so much for I Love Children for bringing this together, helping us do this. And if we could have a round of applause for all our doctors tonight, thank you so much for taking the time. And if your questions were not answered tonight, don't worry. The doctors will be getting them, and they will be doing the answering. Once again, you can head on over to www.ilovechildren.sg. So thank you so much for joining us this evening. I'm Jill from KISS 92. I hope you've learned a lot. I definitely have. Keep the conversation going. They've got support group. They've got a lot of really good help factors as well. So check out the website for more details.